Thank you very much for giving us the opportunity to provide opening remarks. Today we'll talk about how we manage heart diseases and how to live healthy with it. We would like to acknowledge that our iCON office is situated on the traditional, ancestral, unceded territory of Musqueam, Squamish, Teslevatlat peoples. I would also like to acknowledge that you're joining us today from many places, near and far, and acknowledging the traditional owners and caretakers of those lands. And I will ask Ripujit to tell us about her. My name is Ripujit Karundava. I belong to city of Bathinda, but I was born in city of Faridkot. I did MBBS from Ludhiana, then MD anatomy from Amritsar. With that, I'm connected to Panjabi culture, and I joined the dance, Gidda, Uli, and Pangra teams of the college and MC College. With my education, I joined culture programs and I also joined conferences and as well. And I was attached to different forums. Thank you. Let me tell you something about myself. My name is Aline, and with iCON for 6-7 years. Other than joining iCON, I'm pharmacy specialist in medicine, and my purpose of today with iCON is that you understand about your health, about your rights, so you know about those, so you can get information about your health. You can get all the information today so that you can take care of your health in future. What is iCON? iCON is Intercultural Health Network. It's with the University of British Columbia with the digital emergency medicine. With iCON, Ministry of Health also supports iCON, and they are partners with it. Why iCON does this programs? To assist multicultural and indigenous citizens, patients, and caregivers. If it is you or your family member, or your healthcare team, your doctors, pharmacists, dietitians, or your physiotherapist, occupational therapist, any team members that assist you, so you can get information about that. So our focus is to optimize chronic disease prevention and self-management. There are many examples of chronic diseases like hypertension, blood pressure going up, diabetes. You can also call it blood sugar. And these are just examples of some chronic disease. The chronic disease, why they are so important? Because sometimes they are with us for so many years, sometimes we don't know how they will affect our health for longer years. Sometimes we have it for so many years and we don't have any problem. Sometimes you have blood pressure, and for many years those can occur, and it can affect your heart, and it can affect your brain and your kidneys. It can affect your kidneys as well. So about all that we will talk, and we wish to talk about those so you can get all information about those subjects. We also want you to know if you want to get some information online, if you read anything online, then you should know what you're reading, it is reliable or not. We also want to tell you that today. We also want to tell you the professionals, the specialists that we have today, you can talk to them today. Now we'll ask our next expert speaker, who is a heart specialist, cardiologist, Dr. Tarun Sharma. I'll invite him, who has been practicing in Surrey.
Thank you. Welcome, everyone. You spared your time and came here. We will discuss some few things about heart here. I can give you more information. I thank you, Dr. Sangora, first of all, because whatever detail I was about to give, he already given. So I will tell you, I will give you some information about me. I'm a cardiologist. My name is Tarun Sharma. My office is in Surrey Memorial and Gem Pattison, and I'm a co-director there. Some patients I already meet in the hospital and some in the clinic. So today we will talk about coronary heart disease. As Dr. Singh already told you what it is, what is coronary heart disease. I'll give you a little bit more detail about that. First of all, our learning objectives, what is coronary artery disease? As doctors tell you, you have coronary artery disease. I'll give some details about that, and then we will talk about a heart attack. There are a lot of patients, they have problem with heart attack, and then doctors tell them that you have heart attack. So I will explain it to you what it means if you have heart attack, and then later on we will talk about what are the symptoms of heart attack in men and women, what are the difference in their symptoms, and then usually patients always ask one question: should we get the stent done or should we get the surgery done? Then we will talk about that, and in the last I'll tell you how, that patients sometimes question that now we have stent or we have surgery done, now I won't get a heart attack. So we'll talk about that later on. First of all, what is coronary artery disease? Dr. Sugera already told you, but I'll tell you the main function of the heart is the the blood, the oxygenated blood is pumped by the heart to the rest of the body, and it travels through the blood vessels. So these blood vessels, the red blood vessel takes the blood to the whole body, to your brain, to your kidneys, the heart pumps it to your feet, your legs, your body. And if we go to the other side, if we take same the blood vessels, we can go back to the heart. And the heart has its own blood vessels that takes blood to the heart. If there is a blockage, if there is a cholesterol or plaque, we call it coronary artery disease when there is a blockage. So these are the photos I'm showing you. These are the normal arteries. The artery that takes the blood vessel that takes the blood to the heart. If there is there is no blockage. This is, but if we don't take care of our food or don't care of ourselves, then there is a blood pressure, there is a cholesterol, then it start depositing in the blood vessels, and then other effects. If you have other illnesses, infection or other illnesses, then the cholesterol start getting deposited more and more, and then the blockage is too much. Then how it affects when heart has to work more because it has to pump more with more force. So then it needs more blood, but there is a blockage, there is a plaque. So then the blood is not reaching to the heart properly, and then you start getting the symptoms of the disease. So the most common reason is, if we don't manage our cholesterol and diabetes, then it will start depositing in your blood vessels, and then your family doctor, your heart doctor, then they will tell you to the symptoms of coronary heart disease, as Dr. Sangira told you, but I'm going to repeat it again. then you will better remember it. So the most common is pain in the chest. It doesn't matter if it's on it doesn't matter if it's on the left side, it's not present, or if it's on the right side, it's there. It, it's like they feel it like there is a weight put on the chest. That's how people feel. Then they start sweating when they do exercise or do something heavy. Then there may be a heart problem. Maybe heart is not getting enough blood. That's why these symptoms start. Some people say they don't have that much pain in the not that much pain in the chest, but in the shoulders. Some people feel nauseated. Some people feel dizziness. Some people feel the shortness of breath. Some people come complain to me. A lot of people actually complain to me. As Dr. Sangeeta told, it's very common. It's very common in people. When people are getting shortness of breath, it's very common in people. Usually we check lungs. Then we also say we should test the heart as well. Sometimes people feel dizzy. Then it could be a problem in the heart. If you have all these problems, then doctor will do all the test. If there is nothing wrong in the test, then it's this kind of reinsurance that you don't have the heart disease. Sometimes we hear about heart attacks, then we think about pain in chest, tightness, and we should be careful about all other things. If it's not that there will be pain in the chest, there will be other things as well that we should be careful. Like types of heart attack, we will talk about that now. I will tell you some simple things when we talk about this is normal. This is a normal heart when there is no blockage, no heart disease present. Sometimes people feel like there is a partial blockage, and then there is a problem with flowing the blood. Sometimes then you have to put a stent right away. You feel the pain when you exercise, when we do the testing. Then it means there is some blockage and some problem with the flow in the blood. If there is something wrong with the blood test and also pain in the chest, and there could be an emergency, if and go to the hospital, get a checkup done yourself. Sometimes the pain is there and it stops and it comes and goes. If it's all of the sudden severe pain in the chest and it's not stopping, that is an emergency. Then you should go to the hospital and get it checked. It could be possible that there is a problem in the blood flow, and there is a problem with the heartbeat and the blood is not reaching to the heart properly. If there is 90% blockage and 10-20% blood is flowing, non-stemming we call it. Yeah, but if you have that and then there is no emergency to fix it, there is no need to put the stent right away. But in some people, the blood just not flowing at all. It's that much blockage. If you have that kind of problem, that time your heart absolutely stops working. That's an absolute emergency. You must have heard that some people call the ambulance. Ambulance will straight to the hospital, and then right away they did the stand. Sometimes people say that they bring us there, they admitted us for 2 days and gave us medications, and then yeah. So if there is an emergency, then an hour and a half the stent should be inserted. Sometimes if it's not an emergency, then you give the medications, you admit the patient, and then later on you insert the stents. There are other types of heart attacks too. As Dr. Sangeeta told you, if there is an infection in the, then inflammation in the heart muscle also, sometimes there is no blockage, then the blood vessel ruptures because of infection, or there could be heart attack about, there could be heart attack for that as well. That could be the reason too. There are other reasons of heart attack as well. So what are the difference in symptoms in men and women? The common is pain in the chest. If there is a pain in the chest, you should see a doctor. The common symptoms will be present in both, but some symptoms are present in women, not in men, as Dr. Sangeeta told us. Some people say we only have shortness of breath, not pain in the chest. Some people will say, some women will say, I only feel, but I never have pain, but shortness of breath, and I'm sweating a lot. Sometimes there is sleep disturbance. Some people say there is unexplained fatigue. Some people say we have pain in shoulder blades. But I was not experienced it before, but only today. If you have a problem, pain all of the sudden, then you should be worried. If in our family, like older people have it, and there is a problem, we shouldn't be ignoring the heart, even if there is no pain in the chest and there are other symptoms. We shouldn't be ignoring the heart. There is another thing, the heart blockage. When there is a heart attack, the heart blockage, in some women, there is no blockage. In women, it's called microvascular disease. There is no blockage in the big blood vessels, larger blood vessels, but in very small blood vessels, there is a blockage. That's why they had pain in the chest. It's possible as well.
So in women and men, that's a difference. Sometimes there's less blockage in women. Now we will talk about what is the difference between stents and bypass surgery. As Dr. Singera explained it to you, what the stent is, I'll tell you the photo. So it will play over and over again. What we do, as I told you earlier, that all the blood vessels are connected to the heart throughout the body. Dr. Singera was explaining it to you. So from leg or arm, a tube is put in that goes toward your heart. So that tube is inserted. So as we see, you look at the tube, then you put it in there. If there's a blockage, as they're showing it here, there's a blockage, we put the tube there, and then tube has a stent. Everybody must have heard the word stent. It's a metal fabric netting that's put in there, and that opens up your blood vessel. So any cholesterol, old cholesterol that is stuck there, it pushes away. But the risk of that is if you have a stent and you had a 90% blockage, and it has decreased it from 90 to 20-30%. If you go it, if there's a cholesterol in the heart and you put a stent in there, so that's why it's important to take medication for cholesterol so the blockage can be removed. As your lifestyle is, how you live, you eat, and you need to change all that. Uh, that is stent. And what is a bypass surgery? For example, is an angiogram is done where they check the blood supply and heart supply and found out there's a lot of blockage. What is done there then? Then there's no possibility to put a stent in there. We have to put a lot of stunts. More stunts we put in, the more stunts we have, the more possibilities we have closing that stunt later on. So as I was explaining to you earlier, so if there's like 1 or 2 blockages, you can put the stunts in. But if you have 5, 6, 7, 8, 9, 10 blockages, it's not perfect to put more stunts in there because there's a possibility of that stunt closing again, and it can have serious consequences. So that's why we tell them you have too much blockage. We need to do a bypass surgery. So let me show you what's bypass surgery. When you do the surgery done, they cut the chest open. So they open the chest. They go through the bone, open it, and they pull a vein out of your leg. And wherever the blockage is, let's say the blockage is here, and then you put another that vein there. The old block is still there, but you have opened up a new pathway for the blood to flow. People have this question. They said, you have bypass surgery, you must have removed the old blockages. No, we just made a new pathway for blood to flow. And there's artery in the chest. Some people say, and they say, okay, they have a cut in their leg, they pull a vein out. And some people say, they didn't do it, I didn't have a cut there. And sometimes they pull a vein and from leg. Sometimes we use an artery from the chest. So that's the difference there. So just pay attention to that. The old blockage is not going anywhere. There's a possibility of heart attack again if you don't control your cholesterol. If it is 90% and now it's 100%. So cholesterol medication is very important. And in the same manner, people ask, what are the risks? Stunt had a bypass surgery. What are my risks of having a heart attack? It's not gone to zero. You can have heart attack after surgery as well. From 70-80% blockage, it's less now. But the stunts you have, if you're not taking right medication, it can have that again. Once you have the stunts, we give you 2 medications for sure. One is aspirin, then that thins your blood, and the other one is for. It's very important to take both medications. They stop from your heart, from your blood thickening, and one we stop after a year. The other one we continue even after putting the stents in. So that's why it's important. Without discussing with your doctor, don't stop taking your medication. It's not that doctor said everything is fine, you stop it on your own. Only if your doctor tells you to stop it, you should stop. And it's not just a medication that you can cure it. You think, okay, you have this problem, you take the medication, but you need to change your lifestyle as well. You should exercise and you also change your diet if you have diabetes. And if you have diabetes, then their cholesterol can increase if you don't control your sugar intake. Doesn't matter how many cholesterol medications you take. You said you eat this, you don't eat that. But even despite of that, if you don't control your sugar intake, control your blood pressure, that's also important. People who smoke, they need to stop smoking. And exercise is also very important. People usually tell me that I go for a walk, that's not an exercise. I usually tell my patients, When you go for a walk, if your heartbeat is not increasing, if you can still talk in full sentence, that means your heart is not doing any exercise. It doesn't have any side effects, but you should be doing brisk walking when you're walking or jogging. That's really important. When your heartbeat goes up, then your heart is doing some exercise. But even if you're walking, it's not bad. It has some benefits. So my final points are: first of all, you should pay attention to coronary heart disease that is commonly due to the cholesterol blockage to blood flow to heart. So cholesterol and blood is thickening in your veins, blood vessels. Second, what should be careful about chest pain, tightness that you didn't have earlier. It's a possibility that you might have a chest pain. It's not important that it's not really for sure that you have heart disease, but you should get it checked. But shortness of breath, especially when you're walking, and if you're having shortness of breath excessively, those are the common reasons for heart blockages. So talk to your doctor, and then they should send you to the heart specialist. And third is medicines and the procedures to treat heart blockages are important to reduce any symptoms. That doesn't mean your old disease is gone. You should continue to take your medicine. Thank you. As I said, there are many questions. I'll name the speaker, then I'll ask the question. But if anybody else want to say anything, add to it, they can do that. First question from Dr. Sharma. What's the difference between a stent and pacemaker? Can both be put in one person? As I talked earlier, we use a stent for different conditions, and then we can put a pacemaker for different condition. If somebody had a heart attack, and the stent is usually done, and otherwise it is possible to put both. Next question is, just to add to that, stent are put in the blood vessels. Pacemaker is a unit outside with the wire connecting to the heart into a vessel. Next question is for Dr. Sangira. There are many questions about this topic. Stress. How does that affect our heart? How does stress affect our heart? The stress we're talking about, it affects the whole body. We don't pay much attention to mental illness. We don't want to talk among our family about these things. All the mental problems we have, it increases your heart problems, your diabetes, your nerves get tightened. So it affects your heart disease. We should all try all our religions. Either you follow Sikhism or read Bible or Quran. They are all reminding us over and over again to reduce the stress. If you win your heart, you can win the world. Reduce worry and stress. It's better to reduce it, control it. It's better for better health for whole body. Next question is for Dr. Sharma. There are many questions about cholesterol. Everybody's asking, if my cholesterol is normal, that means it's not high, do I still need to take medication for it? The doctor, Singera, talked about it. The people say, if I've been put on medication, the cholesterol level that we target It's our attempt to keep it below that target. If it is below 1.8, then we try to be as aggressive to reduce it. So the main point is, somebody says, my cholesterol is fine. For every person, it's different. It's based on your health. If the level is fine, if a person had a heart attack, that beside cholesterol, there are other issues that we need to control. If there is a swelling, inflammation, then it's effective for that person to reduce the cholesterol medication. And when people are much older, when they're 80, 90, and they think about, the cholesterol that we have now, that you had taken it for the whole life, you reduce the risk of stroke and heart attack, then you try to reduce the medication. But when you have heart problem, you need to take it. Yes, Dr. Segura? The cholesterol hypothesis, as we were looking at the blockage earlier, the theory that came out that it's due to cholesterol, the research you're talking about, that we did some research, fine, we gave some medication for cholesterol, that it will reduce the risk of heart attack. But cholesterol is not the only reason for heart attack. But if you don't control everything, that doesn't mean if you control one thing. If you reduce your cholesterol even 1 millimole, the research is there. What you're talking about here, sometimes people look at YouTube videos or heart attack, then the doctors say cholesterol has reduced. Then they're getting wrong information. But the complete information is there are other things, with cholesterol that you need to control, that you should control as well. Uncle, let me answer your question right away. What we are listening since this morning, there are many reasons. There are many causes that increase your risk. But then you're not paying attention to the others, you're just paying attention to the cholesterol. You need to pay attention to everything. If you're talking about online media, sometimes it's very minor. They make it such a big fuss about it. Dr. Sharma and others explained, if you have high blood pressure and you're not able to control it, and then you think there's no need to control your cholesterol, but if you bring it together, you should try to do it all that. What should be cholesterol level? If I look at it, I send somebody for a test. They take the test paper, they control it for a month, and then they get the testing done. They'll see if it is fine, and then they start doing it what they were doing earlier. And then they say, my cholesterol was normal, you didn't fix it. How did I get a heart attack? You need to have the cholesterol in check every day. It should be fine. Your sugar levels, the medication that we provide to you, it affects your body for 8 hours, 12 hours, 24 hours. If it is for 12 hours, then it's given twice a day. If it is for factors for 24 hours, then you take it once a day. If you take it once a day, then 2-3 days you don't take it, it doesn't have that same effect. If we are telling you that it's to control, then you need to take it every day. To control your body, your illness, if you control it, then you won't face any problems in the future. If you don't control it, the problems are going to get bigger and bigger. And if you take half, and if you keep adding it, if you work as a team, you assist each other, then that can really help you in the long run. Let me ask all the questions. If we have some time later on, then we can ask those later. Next question is for Dr. Singera about blood pressure. There are many questions. They're all similar questions, so I'll just ask one or two. If you have blood pressure going up once or twice a week, then is that hypertension? If you're checking at home, how many times should we check it? How should we check it? Morning or evening? What time? And what is hypertension? So, first of all, the blood pressure numbers are, if they have no other problem or illness, and there are two numbers. One is 140 and 90. It's below that. It should be below that. If you don't have any other problems or disease. If you have diabetes, and if you have heart problems or heart illness or disease, then it's tightened a little bit. As Dr. Sharma explained, if somebody has diabetes, then the bad cholesterol, it's 2.0, the target range is. But if you have that illness or disease, then it should be 1.8. Same thing with the blood pressure. If you have any other problems, then 130, it should be below 130/80. And the rest of the things, when should we check it? Try, if you don't have any worries or tension, that's fine. But if you're worried about it, then you get it checked. The more you check it, the more worried you'll get it. So reduce that worry as well. You should check it according to your body, how it's reacting, and what else is happening in your life. Do it according to that. And if husband and wife are fighting with each other, then checking the blood pressure. And in the morning you get up, your body is relaxed, and your blood pressure might be normal. So those are the things you need to do at different times. And you should look, how your body is reacting to it, how it is working with it. If we eat something very salty and then check it, it goes up. But don't take it too seriously, reduce the tension. Don't worry about, your blood pressure is going up. If you check it once a week, make an appointment with the doctor, talk to them, and tell them, this is fine at this time, it's going up at this time. And the teamwork is very important. That will help us. And they said, don't worry too much, reduce the worries. How can you do that?
The next question is for Gundeep. The other question is why we should do self-manage and what it is. Why should we self-manage if the doctors are taking care of us? Why should we do it? Self-management is very important. Our health is our responsibility. My health is my responsibility. My doctor prescribed the medication. It's my responsibility to take it on time. So who's going to affect it? Me. Whose health will be ruined? Mine. So take charge of your health. It's very important. We can only do this if we understand it. Because slowly, if we are healthy, so it's not important just to be healthy, but also prevent other illnesses for a long time. So if we start changing our lifestyle, it will be affecting our health, our family. When we are ill, it affects the family. life gets disturbed, social life gets disturbed, and along with that, we burden the healthcare system. So, so there is already a big problem with the healthcare system, lot of problems. So, self management is very important. How you do it? Just a small beginning. Just so here we were sitting down, we exercised for 15 minutes. If we do exercise 15 minutes at home, it will affect a lot of things. Blood pressure will be controlled, diabetes will be controlled if you make it a habit. So there will be a lot of benefit. Control your meals. If you are diabetic, it doesn't mean you cannot eat sweet at all. Maybe include it in your menu and your diet menu you have made. Make the adjustments. Even with having illness, how you can control, how you can manage. You That's what is taught in the self management. How you begin it. Sometimes they will do it, just they have problem with starting it. So it's your responsibility. There are programs available and it's free of charge. So maybe you are not aware of it when you can start it and how you start it. So know yourself, tell others, ask questions, ask about education classes, ask your family where we can benefit from. It's very important to self manage. Thank you. The next question is for Dr. Sharma. Dr. Sharma, after your session, we have lot of concerns. It's about the stress close to that. If somebody has stent or bypass, how long you can live? It won't reduce their life. The second question is, if stent or bypass, we take the artery from the leg, what will happen to the leg? It's a good question, right? Next question is, after the bypass surgery, there should be still pain present, or I'll still feel pain if I already have stents. The first question was, people who have surgery or bypass or stent, how it affects life. First thing is, the surgery or stent is done because there was heart blockage. If once there is a heart blockage, the risk of heart attack is there. To decrease that, reduce that risk, we start medication. Bypass surgery or stent, we do it to improve chest pain or reduce heart attack. But if you don't control other things, other aspects, not controlling your sugar intake, cholesterol, then there will be a risk always. If you control all those things, and then your risk will be the same as the normal people. That's the answer to the first question. The second question is about the leg. When we take the vein from the leg, there are two kinds of blood vessels. There is a blood vessel that brings the blood to the body. The other blood vessels are that takes the blood back to the heart. That brings back the blood is vein. There is supply and connection is very good if we cut one, but the other veins are able to bring the blood back to the heart. There will be a cut on your leg, but when we take a longer vein, there will be a little bit of swelling on the leg. But you shouldn't worry about that. There is no need to fear that. The last question was life expectancy when the bypass surgery is done. Our main goal is your main heart related pain should be cured. and the heart attack risk should reduce, and the risk will be reduced in the future, but it doesn't mean that your pain will be zero. Maybe there is still some blockages, but we created a new pathway for the blood flow. There could be still little bit pain after the bypass surgery. We call it stable angina. By we wanted to reduce the load at the heart. We first of all we reduce the chest pain with that. I showed you we open the chest, so we have to cut the bones. So it takes time for the bone to heal, sometimes up to a year. For some people, think that there is kind of pricking. That is because we open the surgery. We did the surgery by opening the chest, and there is bone that is still healing. There are a lot of questions, and I'll be keep on asking about in a line. There are questions about the heart rate, resting heart rate. When you are not doing anything, that's what it means. When your heart rate is 50 to 62, when you start exercising or started running, and then it goes to 170, is it okay? The other question is around heart rate. If we check our heart rate, can we know if our pulse is irregular or is not regular? The first question is about heartbeat. How much it go up from the regular heartbeat? It depends on the age. How old are you? How healthy you are? It depends on that. Resting heart rate normally we look is around 55. Even if you are sleeping, 55 to 60 up to 65 is normal when you are sleeping, but when you are awake, sitting down, not working, not it's normal 60 to 80. When we are exercising, it depends what kind of exercise we are doing. The formula is deduct your age from 220. So if you are doing regular exercise, it should be 80% of that if a normal person. So if a person is 60, so 220 minus 60 is 160. 130, 140 if you are exercising. If there is 20, 25-year-old person and he is working hard, he is doing vigorous exercise, it's okay if it goes above 200. It depends on the health and the age of the person. Like Ajay made us to do exercise. If you do it every day, if you do work hard, then our tolerance, we can increase our tolerance. Don't let the mic go. There is one more question for you. If you have heart disease, what side is better to sleep on, right or left or straight on your back? This is specific for you. If you have heart disease, it doesn't matter. You can sleep on either side. My guidance is don't sleep on the stomach. That's normally told. Don't. If you sleep on your back, then your neck also should be supported. If you are sleeping on stomach, sometimes the neck is tilted on either side, then you can't go into the deep sleep. The heart disease doesn't affect what side you sleep. There are two more questions. One is for Gandeep, one is Dr. Sharma. We are going over the time. After that, Ripujit will bring some information for you. Is it okay, Dr. Sangira? Dr. Sharma told about the swelling on the leg. The advice is once your wounds are healed, we advise wear the stockings. There are special stockings, and then the inflammation and the swelling will go away slowly. Sometimes they use the stockings and then they stop using it. If you continuously pressure talking, then it should be okay. Little bit problem is always there in the body. Thank you. You told. There is a specific question for you, Dr. Sharma. I hope I am reading correctly. So in Surrey Memorial, is there a coronary angiogram available instead of straight and coronary angiography? There is a one question in relation to that too. You recently heard that we had a campaign.
And we're still doing it, that we should have a cath lab in Surrey, that for stunts and all that. The patients who had stunts, if you came to Surrey Memorial, then we sent those people to Royal Columbian Hospital to put the stunts on. That's the campaign we did, that we should have it in Surrey Memorial Hospital, so people won't have to go anywhere else. They can do it in Surrey. We did the campaign for that. Where they put the stent, they call it cath lab, so that's a cardiac arrest lab. Now we're doing fundraising. Our committee has helped a lot. It's still ongoing. We are trying to have a cath lab here. So if you can build a cath lab here, that can help the patients. Somebody asked a question in that regard, how they can donate. Surrey Hospital Foundation, Surrey Memorial Hospital Foundation, if you go to their website, if you wish to donate, there are numbers there. You can call and talk to them. Then they can tell you how to donate. The second question is cath lab, CT angiogram. What's the difference? It's fine. The straight cath, we can do that procedure. You can go all the way to your thigh for the tube. If you, instead of going and doing that tube, how we can do it, it's done in Surrey Memorial. Once a CT scan, there's some waiting for that. If the wait list is more and we don't want to wait, we send for angiogram. But if you think the risk is not that high and we wish to check, but we have some time, then CD coronary angiogram is done in Surrey. Last question for Gandeep. They have campaigns. When you talk to them, you can specify which campaign you want to donate to. You have to. Thank you. I can find. Last question. Our time is done. We just have a couple minutes. For us in Panjabi, that if we have resources for self-management, for the resources in Panjabi, those are available on our website. If you go on that website and put your name down and program for diabetes and chronic disease, there's a program for 6 weeks. So with the chronic pain toolkit, that's available in Punjabi as well. And you can get the contact information from outside. You can email me directly as well. And we also have a toll-free number on website. You can talk to us. And on toll-free number, you can talk only in English. But my number, you can talk to me in Punjabi as well. That's up to you, how you wish to contact us. Thank you so much. Dr. Sharma, if you can answer in short, there are 3 arteries mainly. Then there's extra arteries called. Some people have 4, 5. I was just saying that. Stents. There are 3 main arteries. Some people have 4. They're called. There are 3 or 4 mainly for everybody. That's the first question. Said how many stents? You technically can put more stents, but our attempt is if the 3 arteries are blocked, then we do the surgery. Then if one person had a 1 stent on, a few years later put another one, and a few years later put another one, you can put more stents. But we don't want to put so many stents. We want to control the stents. And the salt you're talking about, there's no such evidence that Himalayan salt or Pakistani salt is better for blood pressure. We're just saying mainly to reduce the salt intake. I wish to thank all our speakers, Dr. Sangera, Dr. Sharma, and Gundeep as well. And from now on, we sow a seed into everybody's mind about knowledge, and they're outside, and there are flower plants on every table outside. And as I said, we give you knowledge today that you can take those plants just like those are outside. Thank you. And I wish to thank our community partners that gave us uh, sport to promote and make it successful. And thank you for media partners as well who improved it and told about this every event, and you could be here. And the presenters outside, the exhibitors, and you went there and you gained the knowledge, and I wish to thank them as well. BC Renal, City of Surrey, Diversity Options, PECs, Richmond Multi Community Services, Self Management BC, South Asian Health Institute, Surrey North Delta Division of Family Practice, and most importantly, the speakers. And I wish to thank them very much from bottom of my heart, Dr. Baldev Sangera, Dr. Tarun Sharma, Vineet Kaur, Kashmir-based Dr. Guljar Chima, Harleen Chauhan, Ajay Singh, who gave us, fresh in our mind, Indeep Sidhu, and Heart and Stroke Foundation, and translators who, some speakers who are learning. Thanks to the interpreters as well, Navdeep Atwal and Pradeep Bains. And from Ministry of Health, Ministry of Partners, and UBC as well, and Ripajit as well, who hosted this event today. Thank you. And first of all, I wish to thank you, all of you who came here and participated and made it us aware about our health and give us wonderful information. You can get all the information, whatever we did today, the recording and everything. We'll put it on our website, www.iconproject.org. If you have borrowed any headsets, please return it at the registration before going. Our next event, and it's about chronic pains, to understand and manage it, will be Dr. Smith Chawla next Saturday, March 16, Guru Nanak Sikh Gurdwaras. And you're most welcome to join us there and attend the workshop there. Thank you. Salutations. Goodbye.